After 7 years on the front lines,
Save staffing!
Amanda Clark is one of the hundreds of Henry Ford Rochester Hospital nurses joining the picket line.
Hopefully that there's strength in numbers, hopefully the hospital comes to the table after this.
Monday morning, around 350 nurses walking off the job after failing to come to terms on a labor contract with the health system. Those negotiations now reaching the 3-year mark as medical staff say they're working in severely understaffed units.
Typical ICU should be a 1-to-2 ratio, 1 nurse to 2 patients. Sometimes I have up to 4 ICU patients in the ER, and I just don't think that that's safe.
The nurses also fighting for equitable pay raises among all departments and union protections.
It's a little disheartening because, you really want to spend the time helping that person feel better, but sometimes you're so stretched thin.
I think that a lot of it stems from when big hospital chains absorb tiny hospitals, such as what happened to ours. You get a corporate entity that runs their not-for-profit like a business.
Pre-op nurse Danielle Juilliard is the vice president of the OPEIU Local 40 Nurses Union.
We all see the solution as being very, very transparent and easy.
This nursing strike, now one of several we've seen in Metro Detroit in recent years. Just this February, our cameras were there as nurses at DMC Huron Valley Sinai in Commerce Township took to the picket lines voicing similar concerns. DC Nurses Association Executive Director Ed Smith says he's seen this issue for over 20 years. Do you see this persisting?
It will persist until the employers start working with nurses and other healthcare professionals about delivering good patient care.
In a statement, Henry Ford Rochester says Henry Ford Health's greatest priority is and always will be the well-being of our patients, team members, and the community. Henry Ford Rochester Hospital has a process in place to ensure our units are staffed in a way that provides the safe, high-quality care patients deserve. They go on to say mandatory staffing ratios, like that being proposed by the union, hinder their ability to adapt based on patient need. The hospital has temporary staff in place and is set to remain open throughout the strike. The nurses here in Rochester plan to picket outside of the hospital until Saturday. They're looking forward to hitting the bargaining table again at the end of the month. In Rochester, Whitney Burney, 7 News Detroit.